Alrighty. Hello, everybody. My name is Brittany Simmons, and this is Ben Shi. And today we're going to be talking about a health promotion program for heart attack in Ross Township, Pittsburgh, for our GPNG 527 course. So background, health promotion program is for Ross Township in Pittsburgh and located in the Allegheny County of Pennsylvania. And the aim is to reduce and control heart attacks within this population. So Ross is located in the north suburbs of Pittsburgh and has a high rate of heart attacks in comparison to other neighboring towns. And chronic disease was identified as a primary health need in 2019 and 2022 for the Pennsylvania area. So overview of our health promotion program for the CDC, the Center for Disease Control, it found that 13 million people visit their primary care office and are diagnosed with atherosclerosis or other chronic heart disease issues. In 2020, for adults less than 65 years old, there are about 2 out of 10 deaths found for coronary artery disease. So our health promotion program is an educational and training program using the health promotion model, and its aim is to prevent and control heart attacks through the improvement of lifestyle change. We also incorporated a telehealth system that will be introduced to increase access to healthcare resources. So our Ross social assessment, this mainly talks about the demographics of Ross Township. The racial makeup is primarily Caucasian descent, with only 2% being Black or African American. About 20% of the population was 65 years or older, with the average age range being 45 years old. Population for the Ross, the economic population, they're usually above the poverty line, with only 6% being below that line. And 8.2% of the population under the age of 65 is disabled, with 2% having no health insurance. So the epidemiologic assessment for Ross, the infrastructure is well maintained and crime rate is very low in these areas. They have a high growing economic assessment. They have malls. They have a big mall. It's called the Ross Park Mall, and they have well-known fast food options such as McDonald's, Chick-fil-A, Wendy's. These are well-known popular eateries, as well as local eateries nearby. About 93% of people that live in Ross own a computer, and that is very helpful when providing a potential telehealth program. And they also have well-maintained medical facilities that are great enough to be able to maintain and handle the full capacity in serving residents in that area. So after analyzing Ross Township, we determined that a lack of access to healthcare is an important reason for high rates of heart attacks, and unhealthy behaviors can also contribute to this issue with the food deserts, maybe with the fast food options and the local eateries nearby, not providing healthy options. So predisposing, reinforcing, and enabling factors, these are all from our ecological assessment. So for predisposing factors for being at risk for a heart attack, being genetics, age, gender, and personal medical history. A family history of heart disease can be a contributing factor, as well as pre-existing conditions such as hypertension and diabetes. Reinforcing factors could be smoking, a sedentary lifestyle, not active at all, a diet that's high in saturated and trans fats, not really going for the healthier food options, going for the unhealthier food options, maybe because of cost or just ease and access, and as well as stress. So these factors can contribute to other diseases such as atherosclerosis, which is a plaque buildup, which can produce a heart attack and lead to a heart attack, excuse me. Enabling factors, these are factors that can prevent a heart attack or cause a heart attack. So these are access to healthcare, either the lack thereof or a plethora of access to healthcare, education, awareness about healthier lifestyles, a support from society, from friends, family, community members, and access to healthy food options, which I mentioned before, and physical activity options. So in our programs, we want to maintain the infrastructures that are within Ross Township, which are the gyms, the local community town centers, town halls, the access to computers with the telehealth programs, and providing healthier food options through food markets in the town squares would be helpful for our health promotion programs. And here's where we're talking about our health promotion model. The health promotion model is a model used to promote healthy lifestyle, encourage a healthy lifestyle, and encourage individuals to adopt these behavior changes and lifestyle changes, excuse me. So our proposed health promotion model is a training and educational program with the help of a telehealth system to increase access to healthcare resources for the 2% that have no health insurance and the individuals that are 65 years or older who are finding themselves at risk for heart attack and heart-related issues, and the delivery of education and training to participants. These are for our older generation and the younger generation, just to prevent the risk and rate of heart attacks if we can get them young and get them early. And our program aim is to raise awareness of healthy lifestyles, enhance the knowledge of heart diseases within this community, and participants will have an expected outcome of doing well and understanding heart attacks and understanding how their risk factors can encourage a heart attack or discourage a heart attack. And they will have a strong commitment to make the change happen when they have community involvement.
Okay, thank you. I want to share my screen. Okay, thank you, Brittany, for your instruction of the basic information of the Ross Township and our health promotion programs and a series of assessment related to this health promotion program. Now I just want to follow you to introduce the step 4, administration and policy assessment. So the administration and policy for the prevention of heart disease involve a range of activities that aim to reduce the incidence and impact of heart disease at the population level. It usually focus on the following areas. For example, the screening and earlier detections, providing access to preventive care, and promoting health behaviors and creating health environment and conducting research and evaluations. Our team tried to identify some special administration and policy in Ross Township to control and prevent heart disease, but we didn't find. So in other words, Ross Township may not have a special program for this chronic disease, but in our health promotion, we plan to cooperate with the American Heart Association to launch a heart walk and to expand the publicity for our program. And this can increase awareness of the public's attentions. Okay, now I want to say something, the implementation. Implementation is very important for these health promotion programs. And for implementing this health promotion program for Ross, require the cooperation between the government, healthcare provider, insurance company, and technology company, and patients. So the first step is to detail the plan, budget the cost, and advertise the program. So here, for the advertisement of this program, we use the social marketing theory to guide this advertisement. And most of the budget should be from the government and healthcare providers. The patients only pay for a small proportion of these expense on the health systems. And the second step to is to identify the participants, install telehealth equipment, and test it. And here, screening plans will be performed. We just follow the USA Prevent and Surveys Task Force, the guidelines, to perform these screen plans. And the third step is to train the participants. The government should monitor these programs to protect the privacy during the process. The privacy is very important, and it could increase the accuracy of the diagnosis. The step 6 is the process evaluation. So this health promotion program is a 3 years plans. So the first step is to check the progress with the timetable. Timetable is very important. So at the very beginning, the leader team will make the timetable to check each process of these programs. Make sure this program will be conducted, will be performed timely and correctly. And the second step is to check how many participants are identified and how many telehealth systems has been installed and how many telehealth surveys has been delivered. And the third step is to check how much training classes were conducted and how many participants were trained. This is the process evaluation. After the process evaluation is to be the impact evaluation. And impact evaluation could rely on some statistics. For example, the incidence rates and discharge rate of heart attack and the increased awareness of heart attack. Telehealth could make it easier for people with heart issues to get regular checkup, which could reduce the incidence rate of heart attack significantly. So in addition to that, after extensive publicity and education, community members' awareness of heart attack should be improved, and they will do more physical exercise. The physical exercise is very important to control and prevent the chronic disease, especially for the heart disease. And then the outcome evaluation. We want to evaluate the final outcomes at the 3 different levels. The first one is the short-term outcomes. For short-term outcomes, we'll focus on 2 areas. The first one is reinforcing goals. So by the help of these health promotion programs, physicians could check patient status in time and educate them to do more activities and adopt a healthier lifestyles. The second one is enabling growth. After putting the health promotion into use, the statistics shows the access to healthcare increase and more exercise are performed. And for the midterm outcomes, we will focus on the behavior growth. And it usually has 4 areas for the behavior change. The first one is people will seek healthcare earlier and regularly. And the second one, to increase the awareness of the chronic disease. The third one is to do more physical activities. The last one is more health diet. And for the long-term outcomes, people with chronic disease will have better health status and their quality of life will be improved. And finally, the expense on chronic disease will decrease. Whatever for the individual out of pocket or for the national level, the expense should be decreased significantly. The last one is the conclusion of our health promotion. And the most effective measures are the prevention and control in advance for the chronic disease. So they were aiming at risk factors and making lifestyles improvement and reducing the incidence rates. This can be achieved through health promotion programs. A health promotion program must be designed and implemented according to the actual situation of the area. And the health promotion model is popular in education and training programs to encouraging individuals to adopt health behavior and lifestyle. We believe our health promotion will achieve our effective goals. Okay, This is our presentation. Thanks for listening. Thank you.